Dear colleagues and organizer board, of course, thank you very much that I have the opportunity to talk in this meeting, and especially that I have the opportunity to talk about some clinical and ethics dilemma in treating elderly people with acute stroke with what we call intensive or a little bit more aggressive therapy. In the first part of my talk, I will just discuss some data about acute ischemic stroke, and in the second part I will try to present our own results dealing with the outcome after recanalization therapy in elderly people. We have to be aware that 60 million of stroke patients occur every year worldwide, and this number is going to be bigger and bigger, reaching 23 million in 2030. And also that the recanalization therapy is the only causal, proven and effective therapy in acute ischemic stroke. Furthermore, 2/3 of stroke patients are older than 75, and nearly 1/3 is older than 80 years of age. And according to recent guidelines, there is no age limit for recanalization therapy. However, we do have some concerns, and the main ones are whether elderly patients are less likely to achieve recanalization or less likely to favorable outcome measured by functional scale like modified Rankin scale. Do elderly patients experience more complications after recanalization therapy, because as I said, it is a sort of aggressive therapy? And finally, is there a cost-benefit invasive treatment of those patients? There are some facts which are actually valid for all age groups and which can contribute or predict the outcome after treating. Collaterals and local vascular thrombus factors are something which we cannot discuss in the setting of age. It's probably the same in every age. But when we talk about elderly people, then we have much more cardioembolic strokes, much more severe comorbidities, and more often pre-stroke disability. And this all leads to the treatment result after thrombolysis, where we have lower rates of good outcome than in younger patients, but same complication rates. Also, we have more, as I said, cardioembolic strokes and larger baseline infarct size when thrombolytic therapy remains questionable. However, 5 years ago, we started routinely to use thrombectomy, meaning taking out the thrombus from the occluded blood vessel. And we already know, after 5 years of experience, that age over 80 is an independent predictor for poor outcome and for mortality, and that elderly patients do have worse outcome than younger ones, which is some kind of logic. However, treated elderly patients have better outcome than not treated elderly patients, and we do have to have a very careful selection, but we still do not have age limit. So let's present our results in University Hospital Zagreb, Neurological Intensive Care Unit and Comprehensive Stroke Center. The results are valid for 2019, and we included all acute stroke patients with large vessel occlusion, which means with severe stroke, who had indication for recanalization therapy according to guidelines. Altogether, we had 139 patients who were thrombectomed, and after that they received standard care. The outcome measures were modified Rankin scale in 90 days and recanalization rate. When we see the number of patients, we can see that in our group of patients, most of the patients were in the age group of 61 to 75, and a good 1/3, even a little bit more, were elderly patients, namely more than 75 years of age. When you look at the recanalization rate according to age groups, we can see that the rate is actually the same in all three groups, meaning even in elderly patients, recanalization occurs in more than 75, nearly 80% of the patients, which is a very good recanalization rate, and this rate is not better even in younger groups. However, when we look about mortality rate, we can see that 17% of patients in the group older than 75 years actually had fatal outcome, in comparison with only 3% in the younger patients group. However, when we know the normal, or let's say expected mortality rate after severe stroke, which is nearly 30%, this is a very good result. And furthermore, 25% of elderly patients were functionally independent, meaning being able to take care about themselves with very small or not disabling symptoms after a very severe stroke. So, in conclusion, I have to say that first of all, according to current guidelines, age is not a contraindication for any type of recanalization therapy. And although overall outcome in elderly people with acute ischemic stroke is worse than outcome in patients younger than 75 years of age, which is actually in every activity you do in this age, overall outcome in elderly people who were treated with recanalization therapy is better than in non-treated people, and our results are in accordance with this statement. Also, comorbidity and stroke etiology are the most important predictors for outcome in elderly. And for take-home message, we have to see the results of large reviews and meta-analysis, which show even in patients older than 80 years of age, thrombectomy as a better treatment modality than standard therapy or just thrombolysis. So all these studies favor thrombectomy as a better treatment considering outcome. So, as we expect a real bigger part of the population being older than 8 years of age, although we all know the sentence saying that the age is not important, but we have to keep our mind safe. So let's keep it also if such a person suffers a severe stroke. Thank you very much.